Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today, we're going to talk about telltale signs of having a facelift. We get a lot of questions and inquiries in general about celebrities and other people and saying, hey, do they have a facelift? And so there are some telltale signs that patients have had a facelift. And I think in general, we hear a lot of patients, their biggest fear, I think, when going in for plastic surgery or a facelift is that they don't want people to know their secret. They don't want to look strange or pulled or done or plastic. It's something that happens very uncommonly, and it's usually a patient that had an older technique. You may be out and see somebody that it's obvious they had work. And in general, like I said, it's an older technique, or it's somebody that maybe was bargain shopping for their plastic surgery, or it was somewhere where they went and either they or their plastic surgeon tried to do too much. And so I'd always tell patients, seek out more conservative approaches to plastic surgery, things that will leave you appearing natural and not plastic and done. So what's the number one telltale sign that you may have had a facelift? Your turkey neck is gone, you look young and rested, and you look amazing. That's what's supposed to happen when you have a facelift, right? So one of the most common signs is that people think you look better. They're going to say, hey, what's going on? You look rested. You look like you lost weight. You look younger. You look more attractive. But they shouldn't walk up to you and go, hey, what happened to your face? Did you do a facelift? For me, the number one telltale sign of a facelift should be you look good. But also that you look like yourself. You don't look pulled, you don't look done, you don't look plastic, and you don't look strange. In general, I just want people to know, even though we're going to go into some of the other telltale signs, that the number one sign should be that you look good, and people are confused to why you look good, so that your secret isn't given away. I do also want to say, in general, after surgery for a little while, you will look a little poofy, you will look a little pulled, right? And so that's when you want to hide out. The second thing I want to say about the surgery is that a lot of people think it's painful, and it's not. It's pretty much a painless surgery. It feels a little numb, a little tight, but it's not a surgery that you're going to be in a lot of pain from. So patients want to go out, they want to be seen, they want to do things, and you may pick up on somebody that looks poofy, but it's just because they're still healing. And I also think we see this sometimes with celebrities. They'll go and have work done, and they may come out for the premiere just a little too early. So they come out, and they're still swollen and poofy from the surgery, and all the swelling ends have come down, and people pick up on it. Oh, they look different, they look strange. But then when you see them several months later when they're healed, you say, oh, well, they don't look strange anymore. Maybe they didn't do something. So I think there is that middle period in the healing phase where if you don't want people to know you did something, allow the swelling to come down, allow the healing to come down, and then go out and present yourself. But in the end, you should, like I said, look like a well-rested, younger, prettier version of yourself, not somebody that's all pulled and strange looking. We're going to go through some telltale signs of a facelift, and it's not in any particular order, so number one isn't necessarily the most common, but the first sign that I think people really pick up on is the over-pulled look. And again, it's something that shouldn't really be done, but when it is done, you notice it right away. And sometimes it's called the dreaded Joker face, or where the face is pulled too tight and it looks like the Joker. And it can alter the look of the face, and it has a lot to do with the surgery itself, and if the patient's being over-pulled instead of lifted and gently having the skin drape back. It is, again, the older techniques were not multiple layers, and the surgeons tended to really pull things tight, and that's when patients look strange or over-pulled. Some patients that come to mind would be like Joan Rivers, or patients that didn't mind that people knew they did plastic surgery, but when you saw them, you said, oh, they had a facelift. And then secondly, I think that has to do with the vectors of pull that's changed as well. They used to pull more laterally like this, and now we're doing multiple layers and different vectors where we're pulling up underneath and gently pulling the skin and really putting things in the face in a much more natural position with much less pull on the skin itself. Now, we have seen some patients that looked over-pulled, like recently maybe Demi Moore would be an example where the face looks over-pulled in certain vectors. And again, it's something to be avoided, and it's something that people pick up on right away when they see that windblown or that Joker face look. So that should definitely be avoided at all costs. Similarly to over-pulled is over-plumped. So the second thing people really pick up on is if during the surgery patients have filled the face too much and it appears poofy over plumped. And very commonly now with the facelifting and tightening of the skin, majority of surgeons are going to add some volume back to the face because aging isn't just loose skin happening, it's loss of volume in the face. So with the surgery, it's very common to add fat grafting in certain areas of the face to fill certain areas that have kind of deflated with aging. Now, if it's overdone, again, patients are going to look poofed up or plumped up. It used to remind me of the Cabbage Patch Kid dolls, or dolls with their faces all poofy and filled up. And two people that come to mind would be Goldie Hawn and Madonna. We've seen different time periods with them when they've looked really poofy in the face. So it could be just overdone grafting and fillers, or they had a facelift, and again, the face was plumped up with too much fat or filler. The idea behind the over-pulled or over-plumped is the word overdone. Try not to overdo it. One sort of patients that this really is extremely noticeable and want to make a point of it is male patients. In general, we have to be extremely careful with facelifts in men. And that has a lot to do with definitely not overfilling them, because it will make them look feminine if they don't want to look feminine. And then secondly is the overpulled thing, because in men it can really drastically change the face because the men have facial hair. So if they're pulling the wrong vectors and pulling things, what will happen is the sideburns can disappear and move out of the way, the hair can be pulled back, and it makes the face look really out of balance and out of proportion, or we'll see strange vectors of pull in the face. And several people that I think of when I think of men that were overdone or overpulled would be like Mickey Rourke, Burt Reynolds, and then even Joe Biden. You can see some of the signs when animating or talking, strange pulls in the face, or things that were pulled not exactly in the right vector, so that it comes off looking strange or something's off in the face. So in men, again, to be very careful not to overdo it or overpull at all. The next sign I wanted to go over in regards to facelift is scarring, right? Whenever we're doing any lifting or removing skin, there's always got to be a scar somewhere. And the question is, where do you hide it, right? So, and over the years, this has changed dramatically, or at least a lot in facelifting. Where we're going to put the scars, how we're going to hide the scars, how we close the incisions, make the scars less noticeable. And some of the older techniques weren't as good. So a lot of patients have it in their mind when they've been out and they've either been behind a woman or a man or somewhere, and they've seen the scars on the face. It's really noticeable, and so it's in their brain. They're scared of that scar. They're like, I don't want to go out and have my hair up, or in men, just in general, people able to see my scars. And some of the older scars used to travel up into the hairline and down the hairline here and have step-offs in the hairline, and you would be able to see it, so women wouldn't be able to wear their hair up and do different things. Nowadays, the scars have definitely moved to some better locations, so patients can be less fearful of those scars being seen. And any of the modern or contemporary facelifts should hide the incisions more inside the ear and then snugly behind here in the crease behind the ear. They shouldn't be coming down the hairline or in front of the hairline as much, because again, people can see those things that can alter the hairline, and then people will know, oh, you had a facelift. Another thing that people don't generally pick up on right away, but I see often, and sometimes just subliminally, or if you're looking at someone you know something's different, is the ears. So when patients have a facelift, where do we hide the scars? By the ears. So if the surgeon isn't very careful of how they're placing the scars and what they're doing, it can change the appearance of the ears or the shape of the ears. And the two most common areas is what we call the tragus, which is this little piece of the ear right here. And if the scar is put in front, it can pull this tragus forward and give you what's called a hidden tragus, and you'll be able to look in the ear canal and you'll lose this piece of the ear. So that's one telltale sign if this tragus is pulled too forward, that an incision was placed here and the tragus moved forward. And that again is technique. If you do a better job, this tragus will not be pulled forward. Secondly is the earlobe. Now there can be, interestingly, our earlobes continue to grow, so a lot of patients will want their earlobes reduced with a facelift. Or if the surgeon, again, doesn't anchor this well, the patient will get what's called a pixie ear, where this earlobe is attached to the side of the face, and that's a big telltale sign of a facelift. And almost all the examples that we just talked about, if we look closely at them, you're going to see a little bit of a pixie ear in some of those patients. Mickey Rourke and Goldie Hawn, like a lot of patients, you'll see that scar pulling down, or if they had an older technique. Now that is fixable, so the hidden tragus or the pixie ear, you can go back and revise it, and you can tuck it up, and recreate the earlobe and pull the tragus back. But it is a small surgery, and in general should be avoided. But again, that's one of the things you can pick up on and saying something's different there. You may be seeing those differences near the ear. Another thing that I look for is mismatch. So when I'm looking at to see if patients might have had a facelift, is one of these things don't match the other. In other words, if a facelift typically is addressing this area from the neck to about the mid-face. So if only a facelift is done and something's not done elsewhere, or they didn't tighten the neck enough, you'll notice this part of the face looks amazing, but the brow has wrinkles and lines, and the eyes are heavy, or the neck is out of balance, or other things are out of balance. So you're going to pick up on something's not matching here. And that's one thing that, again, just looking at a picture, you'd be like, that's off. Why does the cheek and the the jawline looks so pristine and smooth, but the neck doesn't seem to match, or the brow doesn't seem to match. And so that out of balance you pick up on and you say, something was probably done there. The last thing I want to say, and I don't think enough people talk about it, is a change in the smile. And that has to do with, again, the vectors of pull in the facelift, whether they're pulling strangely or making the smile different. So when patients are trying to smile, they're not quite able to smile the way they used to. It looks a little different or off. And those changes can be temporary as well, just from swelling and the surgery itself. But one important area that I pick up on a lot is that we have two muscles here called the depressor muscles. And there's a very common nerve to that muscle. And what that muscle does is pull the lip down like this. So sometimes in surgery, temporarily after the surgery, whether it be for swelling or a slight bruising of the nerve, hopefully not anything permanent, the smile will change. If the nerve on the one side, its opposite, is injured, it won't come down. So that when they smile, it'll be off and one side will pull down and the other side won't. Again, I'm not trying to pick on these people, but if I'm looking at people like Goldie Hawn or some of the actresses, if you look at their smile, you may notice it changed, or that it's not perfectly symmetric, that one side's not pulling up or going down. And that, again, can be a sign that surgery was done there, and usually that will recover over time. One other thing these patients will do, if they have that, and they should know about that, is Botox the other side. In other words, just to balance out the smile temporarily while that nerve is recovering. It's not a common thing to happen, but as far as damage to the nerve, but it can happen just from the surgery itself and swelling and pulling, and then gradually as the healing comes down, all of it returns to normal. But it is one thing you can see, particularly early in the facelift, as a sign that, oh, maybe they had surgery there because their smile changed a little bit. But one thing I do want to say about that is there are some congenital asymmetries in a normal smile. So just if you see somebody with a smile that's asymmetric, doesn't mean they had plastic surgery or a facelift. We even see it in babies when they're born. Sometimes it can be congenital or different things, and their lips can be off. There's many different things that can cause that, but it's just one of the signs that could be that. But just because somebody smile off doesn't mean they necessarily had a facelift. So in closing, since I don't want to be scaring people about facelifts, is that all of these telltale signs are very simply avoidable by doing your homework and seeking out a quality surgeon. The most important thing, I think, when looking for your surgeon is three things. Looking at their credentials as far as board certification, making sure they're board certified in whatever you're trying to do. So if it's a facelift in plastic surgery, facial plastic surgery, somebody that's experienced in what they're doing, somebody that has a track record of being well experienced in the exact procedure you're looking for. And then lastly is their aesthetic sense. Look at their work. Make sure you like the way their patients look after surgery. So you take all of those three things together, looking at their board certification and credentials, their experience, how many of these procedures do they do, how long have they been doing them, and then three, their aesthetic sense, making sure it matches with yours. You like the way the patients look because every surgeon has a little different aesthetic sense. You want to make sure that matches what you want out of the surgery. So just remember, a well-done facelift by an experienced surgeon that's credentialed should always make you look like a younger, rested, more attractive version of yourself. And also, you can avoid all those other things. You can avoid the visible scars, the steps off in the hairlines, the strange appearing ears, or the over-pulled or over-poofed look. So all of these things are avoidable just by doing your research and, like I said, making sure that you're going to somebody that has experience with doing facelifts and knows what they're doing. After a quality, well-done facelift, the facelift itself should never be the one thing that gives your secret away.